I thought long and hard about this because we don't want misinformation. But I think there are two key elements that are very difficult. One is it going to be applied fairly across the board, and does it tread on free speech? And so I did a little Googling, and in February of this year, KPBS ran a story, and the story title was "Reversal of California Outdoor Dining Ban Points to Public Health Confusion." And in it, it talks about there's no clear data from contact tracing that would justify outdoor dining bans. And what was unique about it was if you went back to December 2020, in Politico, the agent secretary, Mark Galey, I may be mispronouncing his name, he's the California Health and Human Services director. And he confirmed that the decision was political versus medical. And so this whole time on our county website, we have listed a policy that was later we learned is politically driven, not medically driven. So that would that make our county website misinformation? Because it is misinformation. And it begs the question, what are we going to do to clear up our own misinformation? But I want to just read this one quote from Dr. Monica Gandhi, a professor of medicine and an infectious disease doctor at the University of San Francisco, University of California, San Francisco. And she goes on to say, "It looks like you're not clearly following the numbers in making recommendations appropriately, and that can really confuse people." So here we are having medical professions, and I pulled some more stuff of how one protest was treated differently than the next protest, and how one was called a super spreader, but the next one was called just a righteous gathering, and yet the numbers of unmasked, unvaccinated people moving together, I don't know how we can tell the difference between political science and medical science, and how we can discern between one doctor who seems to be very qualified at the University of California, San Francisco, and others who approved putting misinformation on our website. So for that reason, I think that this is way too confused, and the likelihood of this being misused to crush public opinion and, more importantly, free speech, I can't support it. I do appreciate that. I do appreciate that none of us want to see our neighbors die, or our family, or our friends, but I don't know how you stop misinformation or free speech, and nor would I want to. So, thank you.